Hello, Dan. I'm Dr. Hausman's nurse, Anita Salud. What brings you to see Dr. Hausman?
I'm enrolled in the Green Dot Public Schools HMO plan. I chose Dr. Hausman to be my primary care physician. I'm here because I have a small itchy rash on my arm.
Okay, Dr. Hausman will examine that for you. Is there anything else?
Yes, I have a few questions about my health care.
That's fine. I can help you. But first, let me collect some information about your health. It will help the doctor when he sees you. Well, Dan, that's it. What are your questions?
Well, I want to learn how to best use my medical benefits and how a primary care physician can help me manage my health.
That's very smart, Dan. It's a good start to taking charge of your health care. What's your first question?
What exactly does a primary care physician do?
As your primary care physician, Dr. Hausman will be your personal doctor, a single source of information for your medical needs, and will help you manage your health through preventive and wellness care. For example, as your primary care physician, he is the starting point for discussing your skin condition.
What if I need to see a skin specialist?
Dr. Hausman will refer you to Dr. Skinner, the dermatologist in our medical group. Since Dr. Skinner is in our medical group, the HMO plan will cover the cost except for your required copayment. If you go to a specialist who is not in our medical group, the HMO plan will not cover your treatment. When doctors are part of the same medical group, you have better coordinated health care and you save money. On the other hand, if you are in the PPO plan, you could go to any specialist in the Cigna network for the network rate and without a referral.
If I don't like Dr. Skinner, can I choose another specialist in the network?
Yes, but you'll need a referral from your primary care physician or the plan won't pay for it. Dr. Hausman will make all your referrals.
How long does it take to get a referral?
If you need one, we will submit it today. It usually takes 1 to 5 days to get the referral. However, if it is urgent, we can expedite the request and it should be ready in 24 hours.
What if I was enrolled in the PPO plan?
Then you wouldn't need a referral. You would select any specialist from the Cigna network for the network rate. But employees enrolled in the PPO plan should have a primary care physician anyway to help manage their health.
What if I need to see Dr. Hausman for a referral and he is not available?
Dr. Hausman will designate an on-call doctor in his absence, so your healthcare services are covered.
Do I need a referral to go to an emergency room?
In a true emergency, get the care you need as quickly as you can. Then call Cigna and your primary care physician as soon as possible. Both the HMO and the PPO plans cover your emergency room costs at the network rate if it's a true emergency, even if the emergency room is not in the Cigna network.
What about urgent care centers?
Since you are in the HMO, if you go to one of the urgent care facilities in our medical group, it's covered. In the PPO plan, the urgent care center must be in the network for the network rate, so it's a good idea to know where the in-network urgent care centers are located near you.
Where are the urgent care centers around here?
It's best to check with Cigna either at mycigna.com or by calling a Cigna customer service representative. Dr. Hausman, this is a new patient, Dan Green. He is a teacher with Green Dot Public Schools. Dan has asked me some good questions on how we can help him manage his health care and what is covered under the Green Dot health plans. Dan, take this additional information. It summarizes what we talked about today. I've also included a helpful SMART patient checklist of what to discuss with the doctor and a Cigna summary on the network.
Thank you. You've been very helpful.
Nice to meet you, Dan. How are you?
Good, except a small rash on my arm.
Let's take a look.
Okay, but I have another question.
Good. I wish more patients would ask questions like this. What did you want to know?
Do you treat other patients my age?
You obviously want to be sure we know about the health issues and latest treatments facing your generation. Our physicians treat many men and women your age, so you can be sure we are up to date on all the latest healthcare information for people like you. Now let's take a look at that arm.